our Be Well podcast. We have a special episode today. November is Diabetes Awareness Month. So we wanted to bring on a couple of folks just to kind of have conversations, ask questions. I am Brittany Braidway. I am a GM with Kanema. Also handle the Be Well website. And I'm going to pass it off to Janine.
Hi, everybody. My name is Janine. I'm also a general manager with Kanema and assist Brittany with Be Well. And maybe Justine.
Yeah, I was about to say, are you popcorn in this? I'm Justine Bowles. I am a general manager with Kanema as well. Yeah.
I'm CeCe. I'm the registered dietitian with Kanema, and I'm excited to join everyone on today's episode to talk a little bit about diabetes.
All right, so this is a super casual Q&A. We do have some questions, prelim questions we'll ask, and then we can just kind of talk through the topics and we'll go from there. So Justine, if you kind of want to go first and just kind of share your story.
Yeah, super happy to do that. So while back, probably around November of last year, I got a pretty bad flu. Things, it was what it was. I was training for a half marathon. I was doing CrossFit 7 days a week, on top of doing the half marathon training. And I was like, starting to feel really run down. And I was like, oh, well, I'm just overtraining. Like, let's maybe think about cutting back. And we tried to cut back. But then a lot of other things just kind of cascaded. I started getting a lot of muscle cramps. So I started drinking a lot of water because I was trying to fix that, but I was also just like super thirsty, which then progressed into, I was using the restroom quite a bit. This included at night. And when my sleep gets disturbed, which I get a little cranky, I like to get my 7 hours at least. And that was not happening if I was going to the bathroom like 6 to 7 times a night. So I started to think, okay, like my body's being weird. I don't really know what's going on. This was around December. And then it took, like, I got up from a chair at my site and I almost like passed out because I got so dizzy. I was like, oh, well, that's not normal. And my fitness manager was like, you need to talk to your doctor. And I'm like, all right, sure. So I shot a message to my doctor. She's like, you need to come in now. When I got into the doctor's office, my blood sugar was at 475. And yeah, they were like, you're a diabetic. I was like, oh, neat. What does that mean? And they were like, well, you're probably a type 2 diabetic. And I was like, that doesn't make a whole lot of sense. I'm fairly healthy. And I think CeCe is going to go into the differences between type 1 and type 2 and all of that. Not that necessarily health is the only thing that would determine, or health factors would determine if you're a type 2 diabetic. But it was that moment of like, I do everything kind of that would prevent that. Like, I don't know what I can do there. So that was in January. I got diagnosed as a diabetic, type 2 diabetic. I got thrown on a lot of medications, start going to see a diabetes educator. Meanwhile, my educator, and thank goodness for her, was like, no, this doesn't make sense. Like, we need to run more tests. Like, I don't know what tests we can run, but this doesn't make sense. And I was like, okay, well, I'm along for the ride. Which this whole experience, on a side note, has taught me a lot about being your own advocate when it comes to healthcare, which I am truly, like, I tell my clients that all the time now. And then in March, we ran, I don't even know what test it was, but we ran a different test that they hadn't really thought of. And yep, came back. I was a type 1 diabetic. So my body is kind of attacking those cells that create insulin, and I'm just not creating enough insulin to take care of my blood sugar. There was a lot of other stuff in between there that was just kind of funky. I had to stop working out for like 2 months, which as a fitness person made me twitch. But yeah, so here I am now. It's October. We've got a pretty good handle on, I know, pretty good handle on what my blood sugar does, ish. I'm still learning a lot, and there's still lots of questions. I'm not on, any kind of mealtime insulin right now. I'm on now I'm giving too much information, which is classic Justine, which we could just cut me off here. But there's still like so much more for me to learn eventually, and this is just where I'm at. We've got a good handle on it, and yeah, that's my diabetes story, essentially.
Oh. Were you like, what was your first initial thought, like being diagnosed? Like, you're like, oh, this is happening, or like, oh my gosh, like, I never thought this would happen.
When I put all the pieces together before I went to the doctor, 'cause who doesn't Google, like, I've got
Right.
this, and this going on? And
So I've
of
got
course,
this.
Google was like, yeah, you've got diabetes. I was like, we'll see about that. So I had a pretty fair idea, but it was still the moment of she told me, and my brain went, oh God.
Yeah.
And there's been moments, and I will say, like, probably when I was not working out and all of, like, my life kind of got flipped upside down for a couple months because I couldn't socialize like I used to, because like the gym is part of my socialization. I couldn't work out. I couldn't eat how I was used to. And I just remember I had to step away from our front desk at one point and just like kind of tuck away and just have a little mental breakdown and go, why me? So like there was some of that too. But yeah, it's just one of those things that you gotta have, like, okay, like it's just part of life. We're gonna work it out. It's not a big deal. Even though it
Yeah,
was
that's
kind of a big deal.
yeah, and that's probably hard being a fitness professional too. Like, we're supposed to be the epitome of health. So, oh my God, heaven forbid we have any health issue, and it just like it makes you feel bad. It's just like, we're supposed to be the example that, right? But like
Yeah.
everyone has health issues, and that's just part of life. So
Yeah.
that's how you deal with it. And I think you're
Justine,
better for it. 'Cause you can help, yeah, like other clients, and it's so common.
Yeah. It's definitely something that kind of opens up the conversation about, like, yeah, you need to, like, if you're noticing something's going wrong with your health, like, you need to go to the doctor. You are aware of what your body is doing. Like, I don't want to say, sometimes trainers, like, we don't know it all, but we truly don't know it all. So if there's something going wrong, like, go seek the help from the right person.
Mhm.
Don't ask me about something weird that's going on, and I'm not a doctor. I can maybe think of exercises to help if it's muscular, but otherwise you got to go to the doctor.
Yeah.
did you have like a hindsight's 2020 moment when you were like, oh, now I see, like these other things, these other symptoms were starting to happen, and like the ways in which maybe you brushed them off, like oh, I'm just super thirsty.
Yeah, so there was like, because I want, maybe in October-ish, like, my gym, we have a leaderboard of the workouts, and like I started noticing, like, I wasn't PRing on my workouts anymore. I'm like, huh, that's weird. Like, I'm normally good for this. Or like running uphill, like, I have never hit a wall, like running up a hill with my glucose probably like through the roof. Like, my legs felt like they could not move. And I mean, like, Brittany knows this. I run. I'm a runner. Like, it was just really weird. And I'm like, why is my body not doing?
It's
And I was
all a
like, well,
muscle that runs.
yeah, I'm like, oh, it's fine. I'm just tired. I'm overtraining. And now looking back at that and knowing, like, tiredness can be a symptom too. I'm like, oh, well, maybe I was a little bit more tired than I thought. The thirst, though, was really the one, because I was drinking a lot of water. And it just, like, did not help anything. And I was like, it is what it is. I'm doing too much. It's fine. That's fine.
Oh, that's scary. But you're handling it well. And I mean, it's how you deal with the situation, and you learn from it, and you move forward.
Yeah.
So,
Yeah.
so CeCe, I think what we should do is kind of explain the differences between type 1, type 2, and then any other types, just to kind of lay it all out for the people listening.
Yes, no, of course. Well, first of all, thank you, Justine, for sharing your story. I know that can be very hard to be vulnerable about something that's going on, especially medical, but I appreciate that. And you bring up excellent points about being your own advocate for your health journey, and also, too, just recognizing what's going on in your body. Our bodies are capable of so much and really do tell us things. And for those of who are used to hearing me talk about nutrition know that I love talking about hunger cues and things like that. And so even something as small as hunger cues versus, recognizing, wow, I'm so thirsty so much more frequently. Those little things all can mean something. So it's good to regularly see your doctor for medical advice, first and foremost. But yeah, so going into the different types of diabetes, I want to start off with the physiology of our body. And so we have our pancreas. So that's the organ that's responsible for producing insulin. And insulin is what helps us utilize the blood glucose or the blood sugar that we have in our body after we eat. So that insulin will help make sure that it's not in our bloodstream, and it'll either be utilized for energy or go into our body for storage. So you'll hear me talk about the pancreas and you'll hear me talking about insulin. And when I say glucose, that is just sugar, just another word for that. So in case I say those words, now you know what those mean. So we have type 1 diabetes, which is what Justine was discussing. And so type 1 diabetes is an autoimmune disease. Usually what happens is your cells in your pancreas that are responsible for releasing the insulin are slowly becoming destroyed. It's also known as juvenile diabetes. We're steering away from that terminology just because type 2 diabetes is becoming more prevalent in a younger age. And also there are cases where type 1 diabetes happens later in life. So it really is dependent how long it takes for these specific cells in the pancreas to become destroyed. It could take a short amount of years, or it could take much longer years in life for this to happen. And so what happens in this, when those cells creating the insulin are destroyed, you no longer can absorb the glucose correctly. So you have insulin deficiency. So usually the treatment for type 1 diabetes is insulin. So you can either inject it every day based off of certain units that your doctor discusses with you, or you can have bolus insulin. So that would be at meal times, kind of what Justine was referencing. And so there's a lot of athletes out there actually that have type 1 diabetes and are able to have successful careers, a lot in the NFL and in the Major League Baseball community, so, and even Olympians. So it's not something that can set you back. You just have to learn how to work with it, especially with the nutrition piece. And especially when you are using insulin, the nutrition component becomes important. So we'll talk about that later though. So then we also have type 2 diabetes. And so this is what's known more as the insulin resistance. So what happens is your pancreas is producing the insulin, but you're just not responding to the insulin. So it's not working effectively. So actually 90% of the cases, or of the diabetes cases in the country, are type 2 diabetes. And I mentioned earlier that we're steering away from the juvenile diabetes terminology for type 1 diabetes because type 2 diabetes is becoming more prevalent in younger ages. And that is mainly because of all of our lifestyles. And so it's the nutrition and the physical activity that plays a big role with type 2 diabetes. So with that, we want to make sure that we're exercising and watching or making sure that we're having a balanced meal and balanced lifestyle with it all. So we'll go into the nitty gritties of type 2 diabetes in a little bit because that, like I said, is the most prevalent of the diabetes, but I'm going to skip over to talk a little bit about gestational diabetes. So this is diabetes that you develop when you are pregnant, and it only happens during your pregnancy. So it's an interesting one for sure. You usually test for this between the end of your second trimester and between the end of your second trimester, beginning of your third trimester. So usually 24 to 28 weeks. And your body just can't make enough insulin to keep up for your demand. And it's not necessarily because of anything that you are doing. It could be because of the size of your baby. It could be if you are overweight before pregnancy, that could increase the risk. It could potentially be because something that you're eating, but honestly, the research around this is very indecisive. There's not concrete evidence proving the exact cause, which is unfortunate, but the good thing is this is something that's routinely measured in your OB appointments. So at that marker, they always will test. There's a couple different tests for that. Usually you'll drink a Coca-Cola drink, and it's about 50 grams of carbs, and they'll see how your body responds to it. So I know it's a little shocking. I saw Brittany's face light up a little bit when she heard the 50 grams of carbs, but your body needs it in order to conduct the test properly. There's actually a lot of controversy. Some people want to just drink orange juice instead of the actual drink, but that would not be appropriate because you wouldn't have the right diagnostic procedure happening. So you're doing it for your health in the long run. You're better off testing it. And so with the gestational diabetes, you are at an increased risk of developing diabetes later on, and your baby at that time is at an increased risk of developing diabetes later on. But if you are managing your diet properly and using temporary insulin, then you're likely to be just fine from that. So that's why diagnostic testing is there. So those are the 3 types of diabetes that we have. And I'd be happy to go more into details about a certain type if anyone has any questions.
CeCe, a question I get a lot, and it's really sad I don't actually know the answer.
Yeah.
What's a normal blood glucose reading?
So it kind of depends, because if you're under a lot of stress, it might be a little bit higher. If you're on certain medications that spike your glucose, it might be a little bit higher. So I'd look at a bunch of different factors.
Yeah.
Usually like around like 97, 98 is like a decent one. Every facility that I've worked for where we look at lab values says a different threshold, like exact numbers. But the biggest thing with diabetes is looking at the A1C levels.
Yes.
And so hemoglobin A1C is essentially an average of your blood glucose for the past 2 to 3 months. And so our hemoglobin is our blood cells, and that's what's responsible for carrying oxygen throughout your body. And so what happens is glucose, so sugar, it glycinates into the hemoglobin, and so it attaches to the hemoglobin. And so that hemoglobin A1C is a percentage of your hemoglobin that has the sugar attached to it. So a normal A1C is below 5.7%. Pre-diabetes is 5.7 to 6.4. And then if you have diabetes, it's 6.5 or above. One thing that I like to mention with diabetes, especially with the type 2 diabetes, once you are diagnosed with diabetes, even if it's well managed and your A1Cs are within the lower ranges, you still are diagnosed with type 2 diabetes. So you still have it forever. But it can be well managed, and you can still live a normal lifestyle, and adopting those patterns that you did to manage it throughout your life can help prevent further complications.
Wow.
With symptoms, CeCe, is there any like noticeable difference, like, in Justine's case, having a different experience, with her symptoms and then having it be found out that she's type 1? Is there a difference in that compared to somebody that might be type 2 and starting to experience symptoms, or are they still all the same?
So they are very similar, which is likely why Justine had a misdiagnosis at first. The only other differences with type 2 diabetes is you typically have some non-healing wounds or some non-healing sores. In my experience clinically, usually that happens with a long-term case where it was never diagnosed and they were living with diabetes for multiple years. So it wouldn't necessarily be all of a sudden. That's usually a long-term complication, but that would be one. Sometimes darkened neck area or underarms can occur with type 2. That typically isn't seen in type 1, but the frequency of urination increasing and the frequency of thirst and even just overall like fatigue, and increase in hunger actually with an unintentional weight loss is common between both of them.
I forgot about that one. I did lose like 20 pounds.
Oh, wow.
So I was like, oh, neat. I thought something was working. Like I was eating right and I was losing weight like I wanted to. Anyway, sorry.
Hey.
I said that to my doctor. She goes, yeah, no. Like,
No. Yeah, so any like unintentional weight loss is always a concern. And, sometimes when I'm in the clinical setting talking to patients and I ask if they've lost weight, they get all excited if they have. I'm like, well, were you trying to lose weight? And they say, no, but this is great. And in my head, I'm all concerned because I'm thinking about maybe they're not absorbing something properly, what sort of malnourishment is going on here. And so if you're experiencing weight loss more than 1-2 pounds a week, that's a major concern. And so regardless of the etiology of the weight loss, that's something that you should present to your doctor, because there could be multiple things going on. So
I just want to go back to like the self-advocating too. Like, I mean, these like symptoms and stuff can be like, you could say it to somebody and they're like, oh, you're just, it's not that big of a deal. But like, I think it is so important to be in tune with your body because, if you're just, I don't know, it's just something that people will be like, oh, I have these symptoms and these symptoms. And people are like, oh, you're fine. You're just going through something, shake it off. And then that person's like, okay. And then they just keep going and living their life with, this ailment. So, yeah, I just want to go back to just being in tune with your body and like being able to like speak up, even though sometimes it might be scary and somebody might tell you like, nothing's wrong, but you're like, no, like something actually is really wrong.
mm-hmm.
Just keep trying.
Yeah, no, I think it's such an important thing to keep in mind through life.
And I would say too, like to get a second opinion as well. If you're not hearing what seems, correct, right? Like, or what you would agree with, and you think there's a little bit more to it, like not being afraid to pursue that. I mean, it sounds like, Justine, in your case, it just so happened that you were connected with somebody whose job it was to help you sort of navigate, this new diagnoses and experience and learn about it, because it is very complicated, to understand and make sure you're treating yourself properly with the dosages and when to eat and not to eat and all of that stuff and what to recognize symptom wise. But it sounds like it didn't feel quite right to you, what the initial diagnosis was. And at least you had somebody on your side who agreed, which is great.
I think that also highlights the benefit of such an interdisciplinary health team. So, having all the components of your healthcare team there and really utilizing it, because whether you realize it or not, they all are there. So having your diabetes educator, having your endocrinologist, having your primary care physician, and having your dietitian and even pharmacist for the insulin, really creating rapport with them is going to be beneficial, even if you don't need to see them regularly, just making sure you have that relationship. So if you do need that, you can see them, because, I wouldn't be able to help Justine with her insulin, but I can help her with the nutrition piece, and her having a great relationship with her pharmacist will help her with the insulin, and, having a great relationship with the endocrinologist can make sure everything's managed from a medication standpoint if need be. So just really utilizing the whole healthcare team and speaking up to your physician about that too can be beneficial. I mean, with most chronic diseases, it's a lot more than just the disease state itself. There's a lot emotionally and mentally that you have to work through, which is challenging, but that's why at least I feel passionate about my career path, to help individuals work through that. And I think most people in this field would feel similarly.
CeCe, question, like how would you recommend, because obviously if you're on a call with people who train folks,
Yes.
how would you recommend us kind of move forward with clients that we might know have type 1 or type 2 diabetes? Is there anything we need to keep in mind as we go through training those folks?
So I think making sure when you do your intakes, knowing all the medical history is pertinent, or any pertinent medical history is so important to make sure that you're well equipped with anything that might happen, especially given the fact that, you know, fainting spells can happen with someone who's having an hypoglycemic incident, or even if they're having a hyperglycemic incident based off of, you know, what they were doing before their training session. So then that way you're at least aware of that if, God forbid, anything happened. And kind of knowing to check in with them if they're using their insulin regularly. Did you eat before if you used your insulin? Because when we use the insulin, so like I said, our insulin in our body, and same thing with the insulin that you're going to inject into yourself, that is responsible for transporting your blood sugar. And so bringing it all throughout the body. So if you did not eat specifically carbs before injecting the insulin, then your blood sugar is going to crash. And what happens when it crashes is you're going to pass out. So that would be the biggest concern from a training perspective. So making sure that your clients are well nourished ahead of time, and maybe even have their quick carbohydrate snack. And we'll get into the nutrition component a little bit deeper, but, you know, having even like a piece of candy, nothing with protein. You want to eliminate the protein, having something quick, or even the sugar tabs that they sell in the store on hand to make sure that if they do have an episode, you can revive your blood sugar quickly. Was that helpful?
Yeah, no, perfect. No, I figured it's just a good thing to cover for folks, A, who might have diabetes and know that they should carry that kind of stuff on them.
Mhm.
B, for any of us trained in them.
Yes. Oh, definitely.
So another training question, and maybe you want to dive into type 2 diabetes before you answer this, but I don't know, you know, Brittany and Justine, if you've been seeing this a lot, but, you know, the more, I guess the medications have been out there, the more I have clients who tell me they're on Mounjaro, Wegovy, you know, these medications that, you know, whether it's for weight loss or because they're pre-diabetic and they need to lose weight, or they're actually diabetic. And so learning a little bit more about those, you know, I think would be really helpful. And maybe for anybody that's listening, that's thinking about taking one of those medications, or if their doctor is, you know, putting it on their radar, you know, that might be a good talking point.
Yeah. Wow, that could be a podcast episode in itself, I would say.
Fair. So that's what I'm saying. Like, I don't know if you want to take that question yet, if you want to do a little precursor convo.
Yeah. So each of the weight loss medications that are typically used for diabetes that has now been into the public, they each have different mechanisms. So each one is going to be a little different. Most of them are GLP-1 receptor antagonists. So that's going to help slow the digestion down and help lower your blood glucose levels. So because it slows digestion down, you're not feeling as hungry as frequently, but it does help lower your blood glucose levels, which is great for someone with diabetes or has prediabetes and has elevated blood glucose levels. But if you're an average person that's using this just to lose a few extra pounds, kind of like how we saw in Hollywood with a bunch of celebrities using it, and they're probably eating well or maybe not eating enough, I'm very concerned for when they're going into a gym and exercising, because who knows what's going to happen to their blood glucose levels at that point. So it's something to be very cautious about taking. There's benefits to taking it for sure, especially if you are diabetic or pre-diabetic, and your trusted physician is recommending it, then that's a go. But if you're someone who's just trying to lose a couple pounds, I'm a little weary of it. Think about some of the consequences that might happen, known and both unknown. That's my quick little soapbox on weight loss drugs.
You
you want to go into like maybe a little bit of the nutrition? Because I always hear like, oh, I just, got diagnosed with type 1, type 2. Like, I have a list of items I can eat, shouldn't eat, can't eat this time. If you want to dive into a little bit of that.
Yes, yeah. So what you can eat versus can't eat is a myth because you can eat most things. It's just about portions. So the main topic of conversation when we're talking about diabetes, nutrition, education is carbohydrates. You still need carbs. You really need them. Your body's reliant on it, especially if you have insulin. So first off, carbs are our primary energy source, especially for our brain. So if you are not consuming enough carbs, anyone, regardless if you have diabetes or not, you are going to have to rely on other macros to provide energy for your body, and that's going to go into different pathways. And so it's basically like starvation mode pathways. And what happens during that is sometimes byproducts are released, including um, precursors to lactic acid. So when you are avoiding carbs, you might have a decrease in your exercise because you are relying on other macros to provide you with energy, because you're going to feel that lactic acid a little bit quicker because the precursor is in your body now. So that is a little bit about the importance of carbohydrates. So like I said, when you are diagnosed with diabetes, you still need carbohydrates. It's going to be dependent on many factors what your carbohydrate serving needs are going to be. My best way of describing kind of how to look forward to planning your meals in terms of carbs with diabetes is based off of serving sizes. So there's a list called the carbohydrate exchange list, and you can find it online. It'll give you it's pretty much every single food you can think of on there, and it tells you what what an equivalent of one serving size of carbs would be. So one serving size of carbs is 15 grams of carbs. So for example, one slice of bread ends up being one serving of carbs because it's 15 grams. So that's how we base everything for your portions of carbohydrates. Most people, it's somewhere in between 3 to 4 servings per meal. And people always look at me like I'm crazy because a lot of people in the general public think that you need less carbs even when you don't have diabetes. So carbs are very important for us. So it's usually around 3 to 4 grams of or servings of carbs per meal. And following that that sheet is going to be your best tool with that. So when we have our carbs, we want to focus on the portion, and then we also want to focus on pairing it with protein and or a dietary fat. So what happens when we have carbs is our blood sugar spikes up, and then kind of like a kid with a sugar rush, it's ultimately going to go down. And so you're going to have that spike, and then you're going to have the crash. So we want to avoid that. When you pair a protein or a dietary fat to your carb, what's going to happen is that your glucose is going to go to a good level, and it's going to stay there long term, probably until your next meal. And so especially for diabetics, we never want to have our carb by itself. So we want to pair that protein and fat. And so that is going to be the most sustainable and most succinct way too of explaining how to pair your meals. Does anyone have specific questions about kind of how to plan your meals?
Just a question about the carbs. So when you're saying carbs and clarity for anybody listening too, are we just talking about simple carbohydrates, or are we talking about complex and simple carbs?
Great question. Yes. So that's gonna, the simple versus complex is gonna change kind of the portion size. So the list that I referenced, that's each food item is a different amount. In terms of, like for bread, for example, since I said one slice of bread is one serving amount of carbs, brown bread versus white bread, the amount is going to be very small of a difference. So I would prefer if you had the one with the fiber, but the difference is going to be a little bit smaller, but you're better off having the one with the extra fiber. And so when we're going back to the conversation about how to make sure that you're prepared as a trainer with your clients with diabetes. So when you are having that crash in your glucose, having this simple carbohydrate is going to be beneficial, because the complex carbs are going to take a little bit longer for you to break down. And so when you need immediate energy, you have to go get that simple carbohydrate. But in terms of mealtime, they're kind of viewed similarly
Okay.
in servings of carbs, just because it's going to sustain you for a longer period of time if you're having a balanced meal. But so going to the complex carbohydrates, so that takes a little bit longer to break down into your bloodstream. So you're going to want to opt for things that are higher in fiber as well, because that's going to help you feel fuller for longer. So it's going to reduce the amount of times you're going to want to eat too. And it's also going to slow down the absorption process of the carbs, because fiber does not absorb.
So you could eat something like, let's say a sandwich, right, with bread, and have more immediate blood glucose effect because of that carbohydrate. But then, if you have, I don't know, like an apple, maybe that's not a great example because there's still like a good amount of sugar in it, but I'm just thinking of like a fruit or a vegetable that one would, delineate as a complex carb, that'll take a little bit longer to be absorbed, right? So in theory, your blood sugar level like may come up and down, but then it's still going to last as the complex carb gets like absorbed by your body, right?
Correct. But with the sandwich, you're probably having a protein with it, or a healthy fat. So it would have the same effect as that the complex carb that you're describing. So if you had like a cracker or just like chips or something like that, that would be more similar to just a simple carb.
Yeah. So you really have to be super thoughtful about what you're eating, when you're eating, where's your exercise falling into place in your day, right? Like, and then not to mention actually taking your insulin on top of all that, what that does. It's complicated.
Yep.
No, there's a lot of factors to think of. And if you think about it too, with the type 1 diabetes and even just the prevalence of children being diagnosed with type 2 diabetes, it's a lot to think about as either a parent of someone with this, or as yourself, if you're, an adolescent having to deal with this too. Like just thinking, even going to recess in elementary school, you're exerting a lot of energy. And what if your recess time didn't fall into a time near snack or lunch? And there's a lot of potential barriers for these individuals.
Sure. Yeah, not to mention if you're a kid. I mean, this is complex for adults to understand and manage, right? Let alone if you're a child.
Yeah, and even being like embarrassed at school because, you're a little different from someone because you have to carry your insulin or have an extra snack,
Yeah, sure.
Justine, how is your adjusting, like your working out time, your intensity? I mean, all that's probably had to be shuffled around.
Kind of ish. I learned to accept that. So I work out at 5 a.m. I have a small like breakfast beforehand. That's obviously changed because it used to be like an English muffin, and then I'd go in and like work out. But, and CeCe, maybe, I don't know if you can speak a little bit more to this, but when you first start working out, your glucose does spike a little bit because your body's trying to use it. And I think it's the adrenaline of how I train on top of the release of that initial glucose and eating breakfast beforehand. And there's some other weird factors, but my blood sugar just goes like skyrocket when I work out. And I've just accepted that that's like, okay, that's just how that's going to be. And then it dips down. But if I do like long sustained cardio, which is a whole nother, it depends on what type of exercise you're doing and what have you. Like if I go sit on the bike for like an hour, like I know at 30 minutes, I need to have some type of sugar because my glucose is tanking. So like, that's really the big adjustment, is just making sure like I have carbs available if I need to go grab them. Watching my glucose while I work out, if it gets too high, I try to like back off and not be so crazy. That actually happened on Friday to me. I got up into like the 300s during a workout and I started to feel really dizzy and just really tired. So I was like, okay, we're done. Like I just have to figure out when to call it quits. The eating thing, that's been the fun part because it is like, yeah, the timing of it is weird because I think if your career is kind of, you can't eat at a set time every day. It just gets weird, right? Like I had, well, Thursday, I'm already thinking about Thursday because I've got clients until 2 p.m. So I'm going to go from 9 a.m. until 2 p.m. without eating. And I know probably around noonish, I'm going to need to put something in my body because my glucose will be in like the lower range of things for me and I'll get dizzy. It's all about
Can you just
dizziness.
be like a little squirrel, Justine, and like keep some things in your pockets and just like pull them out and munch as, through your sessions? Like, is this?
Don't mean to say this, a couple of my
Well-
clients have just accepted that like Justine might have snacks in her pockets and she might like take a nibble halfway through the session because like her glucose is low. And I will say like I've got a constant glucose monitor, so like I've been teaching a class before and it goes off because it's like, oh, you've got low blood sugar. And people look at me like, you good? And I'm like, tough. We're not worried about it. And they're like, but we are. And I'm like, yeah, I'll go get a snack if I need it.
Oh
Yeah,
no.
so it's I guess circling back, like it's adjustments. It's just a lot of adjustments and just kind of seeing how I hate to bring it back to the body awareness thing, but it's being aware of what your body's doing and knowing your cues of like, am I going low? Am I too high? Like, and then adjusting from there. But CeCe, you made a really good point. Like there are no foods that are really off limits. And that's something I had a struggle with at the beginning. But now I'm trying to, like, my whole family's like, can you eat that? I'm like, I can eat anything. I just need to like maybe go for a walk, maybe drink some extra water because I'm not on something that's gonna help lower that blood glucose initially. Like, it's all good. We'll figure it out. I don't know. I might be too laid back too. Could go either way.
No.
You should give me like a little fanny pack of snacks. Just like
Yeah.
Ooh,
little
I like
snack
that.
pack.
And fanny packs are so in right now. This is
Yeah,
a great
you need
idea.
It could be a win-win, and I'll just like have a label on it. Just needs
Just
snack
use
pack.
fanny snack pack.
Snack
love-
fanny pack.
Oh. Well, I
So,
always snacks with me.
What CeCe, what would you say, and again, just to kind of bring this back to the training, what would you say for us to say to our clients or how to help manage our clients who want to start personal training because they're pre-diabetic and are concerned about it turning into type 2 diabetes? Like how do we help them on this journey aside, from the actual exercise programming? Like, do we have things that we need to look out for or be concerned about? Are there symptoms that go with that as we talk about, being aware of our bodies and how they're feeling?
Yeah, no, just making sure that they're in a good condition when they're ready to exercise, start, at a good pace, especially if this is, one of their earlier steps in their exercise journey, meeting them where they're at. And if they start to ask questions regarding their prediabetes, referring them out to the primary physician so that they can get adequate testing and lab values, because really, I mean, even medical professionals can't do anything without proper testing.
Sure.
Well, again, a lot of great information. I'm sure people will have questions, and we will now be able to go back to our clients and be, if we notice anything or people have questions about this topic, hopefully we're going to be a little bit better equipped with how to help them, how to answer those questions, direct them to the right people, give them the confidence to like self-advocate for themselves if they've been getting a lot of pushback. So a lot of great conversations to be continued. I think this can be a whole, we can go into more episodes, about the nutrition, like we can just dive into a lot of detail.
Oh yeah. it was just scratching the surface, honestly.
Oh,
So I
thank
hope
you.
everybody, yeah, enjoyed the conversation. If you have any questions, feel free to always reach out, to your GMs at your sites or us. Any of our dietitians on staff can be helpful too. So I hope this conversation helped people. You got a little bit more information, learned a little bit. Anything else? Anybody have anything else to say? Questions?
Mhm. Thanks for sharing,
Okay,
Justine. Thanks, CeCe,
Yeah.
for your knowledge.
Yes.
Thank you. Thank you. All right, ladies. Well, I will say maybe until next time. All right.
Thanks, Brittany. Bye.
Bye, guys.